I'm Sebastian, CEO at Carevoice, a Shanghai-based insurtech transforming healthcare experience to become more consumer-centric. For insurers, we are leading the way to enable them to become true healthcare partners of their insurance members. I'm very thrilled to be here today because we've just launched with Ping An, Chinese leading insurer, the first fully digitalized health insurance solution for startup teams in China. So China industry, healthcare industry, has been dominated by large public hospitals delivering poor healthcare experience to people and basic social insurance with very limited coverage. So the huge consumer demand for better healthcare has driven massive investment and growth of private health services. Chinese affluent customers are starting to be insured by their employers or themselves, and the premium for mid-high-end health insurance should already reach $4 billion USD in 2020. We help insurers tapping into this market, addressing three key problems they face. First, the mistrust from consumers for health services that limit adoption or usage of insurance. Two, the disparity in terms of quality and cost of medical providers that has an impact on profitability and require to guide members to more cost-effective centers. And three, the gap of digital service in a very mobile-savvy consumer market. Interestingly, these three problems remain true and valid for insurers across geographies. So how do we address these problems? All of you must know Oscar Health or Alan and their very compelling digital customer experience. Think about such experience now enabled for any insurer. That's what we do at Carevoice. We bring mobile-based, data-driven solutions for insurers so that their members can stay healthy, find medical services and access those services, and easily use their insurance benefits. We are uniquely positioned to support insurers because first, Carevoice is an independent mobile platform open to the public. Our end user can share their experience and get rating and recommendation about medical providers. For insurance, through our SaaS software as a service, we digitalize the healthcare and insurance journey for their members with their interest first in mind, so that the insurance can really reach the cutting edge of innovation, get closer to their customers as ever, and drive efficiencies and costs down. Enough talking, let me show you how it works. So I'm a policy holder of AXA, one of our clients. And so when I receive my policy pack, I'm already pre-registered. I can easily sign up in one step. It's my personalized health assistant. I have my member guide now anytime with me. So let's assume sometime later I don't feel so well. I want to consult a virtual health assistant. Let's try.
Hello and welcome to the symptom assessment tool. My name is Molly. Okay, now, please tell me your main symptom.
Hello, Molly, I'm coughing.
It sounds like you're asking about a cough. One moment, please. Have you had difficulty breathing since these symptoms began?
No.
I see. Of the following possible emergency symptoms, please choose all that apply to you.
So you understand how it works. So let's skip some questions and go directly to Molly's recommendation.
Thank you for your time. Based on your responses, I recommend that you manage symptoms at home. For my full assessment, please click the button below.
So our virtual health assistant supports pre-diagnosis and triage before recommending to relevant medical providers. The self-care outcome avoid useless consultation and generate savings. It illustrates also we keep upgrading our technologies with third parties like Sensely and Mayo in one unique mobile experience. So now let's assume I need a doctor. I can search this doctor by medical condition or specialty or connect it with Molly's recommendation. I'm gonna get a recommendation and rating of hospital, clinics, and doctors. I can localize the clinics nearby. I can also see a detailed level information about each doctor. I can easily select the medical providers based on my insurance network, what is inside the network, non-high cost provider, direct billing service. And when I look at the clinics level, I can see what is really my coverage with my own plan. For instance, outpatients, inpatients, can check the reviews, and ultimately be guided for an appointment making. Along the journey, we help the insurance member to be guided to high quality and cost-effective center with the confidence of how other people have experienced the care, and an independent recommendation solution. We also help digitalizing the claim experience. You can see at any time your claim status, see if you need to submit the additional document. You can do it very easily, submit a claim online. You can know the status of your balance benefit, and before seeking care, know your situation. So actually, for insurers, we are really digitalizing human-intensive customer service and claim management that drive efficiencies and leading to generation of TPA 3.0, like it happened in bank when your clients are online, then they move all the paper into electronic. There is also a social component with the experience. You can interact with other members. You can have more insights about their experience. Each time you can rate your medical experience. When you process your claim, we are asking you what the quality of care you receive, generate further insights and needs from insurance members. And any contribution of the insurance members are provided with rewards. And the rewards are more on the staying healthy, so it could be preventive, it could be checkup, so that really to engage the members along the way. So we generate, of course, a number of data points, and this is just an extract of analytics to show you, for instance, there are some data about the user of these insurance services, how their medical experience, there could be deep dive, one specific hospital or clinics, and even about the insurance evaluation. So now, let me conclude with a few elements of where we are to date. I think we can go back to the final slide. So we have gathered roughly 500,000 users on the open platform. The SaaS solution to insurance have been adopted by over 50% of insurance members, granted an access to. We've been working with more and more insurance, like AXA, Ping An. Munich Re recommend our solution to their insurance member company, and we integrate with various TPAs. We are now expanding across Asia with first a metro market like Hong Kong before going global, continuing to transform healthcare experience to be more consumer-centric. Thank you.